Well, thank you so much for taking the time out of your busy day today. Now, listen, before we get started, I want to let everyone know who's watching today, there's a reason that I stay so connected with Dr. Sonia and her tips. First off, a lot of people don't know, or a lot of people do, not everybody does, that Dr. Sonia and her husband, Dr. Bansal, I'm going to call you the dynamic duo. Now, obviously, he is a world-class plastic surgeon. You're a world-class, of course, board-certified dermatologist. I know you have patients from all over the world, Dr. Sonia, so you coming on here is such a gift. But listen, as you and I know, people are stressed out right now. You know, we're trying to stay positive. We're trying to stay happy. But, you know, some of my girlfriends even, can we talk about hair care today? Because that's a big deal to me. Is that okay?
Oh, yeah. Absolutely. Absolutely. Thank you for having me on. I think you have a great audience, and really education is where it's at. I want to help empower people to do the right things and, you know, have options. So thank you for having me.
Of course. Well, listen, so some of my girlfriends are saying, all right, I'm not really going anywhere. I'm just not going to wash my hair regularly. And I know a lot of people, I mean, is there a right or wrong, Dr. Sonia? What do we do? And how does stress play into all of this? I mean, please share us your knowledge. We need some education.
Well, Jewel, that's a great question. Just like we do, you know, our skincare routine, we should also be very vigilant about having our hair care routine. It really is all about holistic wellness rituals that's going to enhance both, you know, your scalp health as well as your hair. So, you know, what's nice is now that we are kind of at home, not having to go out, we can actually go more natural, which
Right.
is so much better for our hair rather than all the heating and styling and the chemicals. It's nice to actually take a break from all of that, which is how nature intended it to be. So what I'm finding is that people are going more natural. Their hair is actually getting healthier. I mean, I haven't done a whole lot, but then I don't do a whole lot with my hair. I would rather it go natural. So I think, you know, doing all the things that we don't get a chance to do, like maybe oiling your hair, especially the tips. This is where a lot of our dead ends are. And so just taking good care, especially because we can't get to our salons right now. We can't get our little trims to help the health of the hair. You can do some of those little things at home by staying away from heat and chemicals and oiling your hair, helping your scalp, maybe using a exfoliating shampoo, and just staying away and go just all natural. I think that's really what's best for our hair care right now.
Okay, so I know everybody's different, but how often should we wash our hair if you just have regular hair, not, you know, not greasy, not dry, just average? What would you say?
So I think that the less we shampoo our hair, the better it is, because we want the natural oils to actually come through our scalp and actually be able to moisturize our hair locks. So what people do is they actually, because of all the hair care products, they end up, and also going to the gym, which we can't do either. They're actually washing their hairs, overwashing their hairs. You don't need to wash it every day. I mean, a couple of times a week is just fine. And again, it depends on the oils, that actually how oily your scalp is. So if somebody who's got more oily scalp, sure, wash it a little more often. But somebody who's got more dry scalp or has more of the frizzy hair, we want the natural oils to actually penetrate and get into the hair follicles and hair roots and actually help that. So I think the biggest thing is don't overwash it and do everything that you can to nourish it.
Okay, good advice. Now listen, I know a lot of women or a lot of people think that, what about hair thinning or hair loss? It's only for men, right? But I've learned stress is such a big factor in thinning hair.
Yes.
So, I mean, can we talk about women for a moment? What do we do about that?
Yeah. So, you know, hair thinning and hair loss is definitely a common problem across the board. We found that 40% of women are actually coming into our offices and in offices with hair thinning. And it just hasn't been talked about before. It was thought of as more of a male problem, but in fact, we see it for both, including postmenopausal women. That's a whole other category as well.
Oh, so it's a hormone thing a little bit, is that right?
Yeah, there's definitely hormone imbalances. You know, you go through your normal hormonal shifts throughout your life. We've got some stress and anxiety, which is also lowering our immune system right now. You know, we've got a lot of little triggers and factors, and there's a whole host of reasons why people can actually thin out and lose their hair. Stress and anxiety is definitely at the top there. But also, you know, what's your medical conditions? Do you have any autoimmune conditions? Are you on any new medications? Pregnancy, we know, obviously can cause that transitionary cycle. You know, what are you doing externally for your hair? How is your diet? There's a whole host of multifactorial reasons why we thin out. And of course, the number one reason is genetics, genetics and aging. So there are some things we can control in our extrinsic environment, and there's some things that we can't control.
Hmm.
And that's what's important, is to seek help when you've tried everything that you can in your lifestyle to be able to eat well, eat a
Right.
nutritionally balanced diet, make sure that you are causing less of the styling and heat processes, making sure that you are also taking vitamins. I think that's so important. What people don't realize is, if you're thinning out, these are some of the things you can do at home. And heck, we're in quarantine right now and you can't see
Absolutely.
anybody. So great, this is the perfect time to be on an oral supplement. My favorite go-to is Nutrafol. Nutrafol is one that I actually use as well for just hair thickening and prevention. We'll use it for our men and women who are thinning out for any reason. Really, it helps for any reason, any underlying factor, especially when your immune system is down right now. I think that's a really great one. It has ashwagandha. It has turmeric. It has a lot of natural holistic stuff that we know can help with the hormonal balance and shift into that growth phase. It also has biotin. I usually recommend 300 micrograms of biotin to take along with folic acid. So it's a great cocktail of antioxidants and
Hmm.
also hormonal regulating natural and medicinal things that can actually help you. And it's drug free. You don't need a prescription. It's drug free. It's holistic. It's gluten free. And
Wow.
it'll also elevate your mood and help your sleep at the same time. So it
Really?
helps a
Okay.
whole host of things.
Okay, doctor. Here's the deal. If it's good for the doctor, it's good for me. How long have you been taking Nutrafol?
I have been taking for the past 6 months. My husband takes it because he actually has male pattern thinning, and he likes taking the Nutrafol because it's something that he could do without the side effects. So there's
Oh.
a prescription that he can take that is actually really helpful, but there's some side effects associated with it. And so a lot of men don't like to take that prescription. So Nutrafol becomes a really great alternative to
Ah.
start with.
Okay. So you said this is fabulous. So obviously, so it's never too early time to start taking Nutrafol. What, an
No,
age?
I think it's a very safe, holistic, drug-free pill that you can take. It's once a day, about 4 capsules, but it has all the good stuff to help with immune function as well as nourishing your hair follicle. So it'll
Wow.
only prime your skin for the next step, and then the next step could be coming into our office to talk about other non-invasive options, including light therapy. There's some hair caps or some minimally invasive options, which could be, the new thing is like PRP injections to help
Right.
stimulate through using your own blood and stem cells to actually nourish and help with the stem cell growth of new hair. And then finally, hair transplants, which is more of that permanent fix to help
Right.
with a long-term solution. But either way, Nutrafol is something you can start right away, and it's something that you should stay on. Really, if you want to keep your hair growth going, it's something you'd want to stay on, but really at least a minimum of 3 months to see the full growth. And then also, it'll help prepare and prime everything for whatever step you decide to take, non-invasive or the more invasive options.
Okay. So you said that's non-prescription, of course. So can one stay on Nutrafol forever?
You can. It's a very safe,
Like a
holistic
multivitamin or something, so to speak?
Yeah, there's people that have been on it for years without any
Oh,
problem and have actually seen some hair growth. Now, it's not going to give you the hair growth that you had decades ago. If you're, going through postmenopausal hair loss, it's not going to give you your hair back when you were 20s, but it can help for people who are not ready for maybe surgery or don't want the in-office treatments. It's something they could do easily at home, something simple and something very safe.
so it should be able to maintain what you have, hopefully, right?
Yes,
Okay.
yes.
So you said something that's really interesting to me too. Obviously, a lot of people aren't sleeping right now. And I'm not saying it's a sleep aid, that's crazy, but how does it, you said it helps you sleep. Did I hear that correctly?
Yes, yes. So some of the natural ancient ingredients that actually in the Indian culture we use, such as ashwagandha, turmeric, all of those can actually help with, helping your hormones as well
Oh
as
my
helping you
God.
sleep. So it's got a multitude of different effects. We don't quite know how it works, but we know that it can actually help your mood stability. So if you're going through some of that stress and anxiety and you're finding it
Oh
hard
God.
to sleep
I
these days,
love it.
even for that effect, it can help you, kind of just maintain a little more balance in your life.
Wow. That's incredible, Dr. Sonia. Okay, so listen, you have great hair though. I mean, I think you're one of the lucky ones, but you know what? Why not keep what you have, right?
Absolutely. Yes. Yes. Because you know what? I'm not immune to the aging process, which can also lead to hair thinning over time. So it's
Right.
great for my women, especially if they are styling their hair a lot and they're worried about, losing. The most common complaint I get for the people that come into my office are, I wash my hair and I see this clump down my shower drain.
Right.
Am I going to lose all my hair? Am I going to go bald? Like, that is a huge fear for my women, for sure. And then my men also, I mean, they start noticing and they think, oh my gosh, I don't want to end up like maybe somebody in the family, like their father or their mom who has really thin hair, right? So what can I do to prevent it? It's very, it's psychologically very impactful when you losing your hair is so close to you. I mean, some
Oh,
people, their
absolutely.
identity is their hair. So
Yeah.
they come in and they're fearful of all these other myths, like, am I going to lose all my hair? Am I going to go and grow bald? And the answer is always no. You're not going to be bald, because the hormonal problem that we see is really up in here. We're actually protected in the back of our scalp. It's right in here where it's more hormonally sensitive. So if you'll notice, men who are thinning out, they'll always thin in here and through here, but not in the back.
Right. Right.
Because that's hormonally protected. There's certain receptors there that protect you versus the ones that are up here in the frontal scalp. So that's why this works so well.
Okay, well, Doctor, so what I love about you is the education. That's what people are dying for. And we need that. And let's face it, we have time to learn. So with the Nutrafol, I'm sure if you are selling it through your practice, correct? Okay.
Yes.
If you're selling it through your practice and you're using it and it's holistic and natural, I mean, this is information people need to know about. That's why I really wanted to talk to you today about this. Now, since you're on, we have you, we might as well ask you the question. You said you take 4 of those a day. What's the scoop on that?
Very easy. You can take it in the morning or in the evening. It's very easily digestible. You could take it with food. It's something that you're not going to notice overnight. So, for people who are like, let me just try it for a month. If you're going to do it, I say do it. So you want to go for it and just do a good 3-month minimum to really be able to see the results. And usually what I'll find is my women will come in to say, my part, I can see more of my part, my hairline through here. And my men will say, yeah, I'm receding and I'm seeing more of my scalp show or my vertex. Well, they'll start actually seeing some filling in of some tiny baby hairs and eventually maybe sprouting up of new hairs. It's maintaining the hairs that you have, but maybe growing a little bit more, which is nice to be able to see that over 3 months. 6 months, you're going to see even more. And that's where you want to really be able to maintain your results, because if you get off of it, you just kind of go back to baseline. You'll never lose everything, but you just start losing hairs again.
Okay. So it's kind of like when you eat broccoli, don't eat it, for 2 weeks and then get off it. We need the benefit all the time.
Right. You got it. Exactly. It's a good maintenance program for people. It's a simple thing. It doesn't have, side effects associated with it because it's so holistic, and it's something that everybody can do. And there's no real contraindication to it. So it's a great starting point for somebody who's like, I'm starting to lose. What can I do? They can be proactive about doing something at home, but then know that there's other options in
There's other options, right? Like say, for example, you discovered that you want to do something when really almost all your hair's gone. I know you offer things like that.
Exactly. Nutrafol is not going to be the only thing that help you. You're going to need to combine it with other things.
Oh my gosh. Well, once again, Dr. Sonia, we are trying to speak to men and women, in their 20s and 30s, all the way up to their 70s or 80s. We just want to look our best at any age, right?
Yeah. And what I'm finding is more and more younger patients are coming to us. I mean, we actually did somebody who was like 19 for a hair transplant, female. She came in, she worked at Tesla, and she was coming in. She had this just years of hair thinning, hair falling out. She didn't have any medical reasons for it. It tended to be just a genetic early, turning on of that mutation gene. And she was starting to notice it enough that it was impacting her whole life, which is why we went so aggressive with her, because she was being impacted in so many ways. And that's the thing. Hair is so close, and it's just part of your identity. And I see that my women will come in with their wigs and all sorts of things, and it's so hard for them to take it off and show me what is going on, and then to make sure that they've got it all put back in place before they leave and actually go out in public. It's it's devastating, and it's great to know that there are things that can be done. There's things you can do, and there's ways that we can help.
Well, I know you want to make things as affordable as possible too, Dr. Sonia. So with the Nutrafol, I always like to give our viewers a special or a little incentive or something, because I know the benefits of Nutrafol because I've seen people use that, and actually I'm going to start using it myself. But what can we offer our viewers today? to make
I
this
think
easier?
I think it would be great for the viewers to, if they're saying, I am just tired of dealing with hair thinning and hair loss, but I'm not quite ready to take the other extra mile, that step. This
Right.
is just something easy to do. I would say start with a 3-month supply. So we're giving away 3-month supply for $199, where you would save about $50, I believe. Don't
Oh,
quote me
that's
on that, but
good.
it's a
Okay.
great deal for somebody who's like, I am committed to getting my hair back. What do I need to do? I'm ready. It's a great 3-month supply, and then you'll get to see some of the difference, but really maximally you'll get to see it at the 6-month mark. So I think that would be great for your viewers to be able to try something at home, especially during the quarantine time when they can't come in for the other options.
Yeah. Well, I love this. And the other thing I like about this too is a vitamin that's good for your hair just has to be good in general. I mean, I'm not a doctor. I'm not making any claims. It just seems like common sense to me.
Yes, yeah, and it's got other B vitamins in there as well, so it's great for a wide variety of different things. And we're deficient in some of the minerals, and so it's a great way to be able to nourish and be able to capture, everything that we need, along with things that'll grow our hair and our nails. By the way, I should say, it grows your nails too.
Oh, nice. Okay. I know you're also going to be doing some things on Instagram. How can people follow you and really keep up? I know we're going to be, of course, my friends, delivering regular segments to you so you can take advantage of really Dr. Sonia's wealth of information, but really her bigger heart for really wanting to help people. So where else can they follow you, Dr. Sonia?
Yeah, so follow us on Instagram and Facebook. We will also be, we're at Elite MD Spa. We'll offer some live Facebook live and Instagram lives as well, to get maybe some people who have questions on, as if they're comfortable coming
Nice.
on. That would be
Mhm.
great to be able to have you guys on and really share, what you guys are going through, and how do I kind of approach the consultative experience, and how do I kind of go through it, because a lot of people can learn just by sharing your own
Right.
problem. So that's another place. And I'm always open to other, anything you guys want to learn about, let me know, and I could do a segment or a video, or
Yes.
have you on as well, Jules, and we can go
That'd be
over some
great.
of the top, questions that you all have.
Right. And it's 1-833 Dr. Sonia, correct?
Yes. Yes.
And then you, to get the Nutrafol, to get the 3 bottles for this great price today, where should they go?
Yes, so visit our website, elitemdspa.com, and under the store, there's a section for just hair products, and Nutrafol will be right in there. And I believe the promotion will be running for a limited time, but it will be there for you, 3 bottles for $199. I think you'll definitely see the difference in that period of time. And then hopefully by then we'll be open for business.
And another way to just keep ourselves feeling good on the inside and also looking our best on the outside. So Dr. Sonia, thank
Absolutely,
you
yeah.
so much. And once again, if any of you have any ideas for segments you'd like me to do with Dr. Sonia, she's a wealth of information. She's always learning. I mean, you've written books, Dr. Sonia, and you're always learning. So that way we don't have to, we just hear it from you.
And I learned from you guys too. You guys actually tell me and compel me to talk about all the common, things that you guys are going through. So it just compels me to do more videos, more education for you guys. And, we're really passionate about education. We want to probably start another podcast as well on just a mini medical school, so that you guys will not be a doctor, but hopefully I can give you enough information so that you can kind of be like little mini doctors who can be able to make your own decisions and be a wealth of information for your family and friends.
I love that. Well, another thing, when we are free to open, Dr. Sonia, so many people have seen you on TV, on various shows and channels, but where are you located when your doors can open again? Why don't you tell people that?
So we're in Danville in East Bay, beautiful area. We have 3 offices. And so we have a plastic surgery center that focuses on in-office treatments, from body sculpting to mini facelifts to hair transplants. And then our neighboring building is all non-invasive body sculpting. So we have the Elite Freeze going on. We do a lot of consultations. And we have our final office where I'm at, where we do a lot of the injectables, and we have 40 lasers. And so that's more of our minimally invasive and non-invasive technology. So we truly have options for everyone. We can build a tailored, individualized protocol just for you.
Right. And once again, those are all in Northern California in Danville. But I know patients come from you from all over the country. So Dr. Sonia, thank you so much. Stay healthy and well. And my friends, we will be back next week, week or two, with another segment. So any questions, feel free to connect. And I would definitely check out the Nutrafol, because it's a great thing. Thank you so much, Dr. Sonia.
Thank you, Jules.